So when discussing PCI and HIPAA, a lot of people like to discuss them as though they're one entity. The reality is PCI and HIPAA have two completely separate focuses and are very different types of assessments. HIPAA has two types of controls, addressable and required. Addressable controls have to be done in the fashion that's spelled out within the HIPAA legislation. Required controls have to be done exactly as they're stated. Addressable means that you can meet them via other fashion. With PCI, almost every control is considered addressable, and that you can develop a compensating control to meet the intent of that requirement, but perhaps you don't have to do it the exact way. HIPAA in itself also is a maturity rating system, so that when security risk assessments or analysis, called SRAs, when those are performed by external parties, they look at year to year to see, has management properly addressed the risk from the previous year? Does management have a thorough understanding of their risk appetite and risks threshold? Are they using a risk assessment to help determine the direction strategically and tactically of the company for future years? Healthcare addresses all of these types of items, where PCI is a point in time to make sure that you have all the individual pieces done at that time. While PCI is indeed a point-in-time assessment, and HIPAA is a continual assessment, PCI needs to be treated as a business-as-usual security framework. So while the assessment itself is based on a small period in time, a lot of the controls do evaluate a company's ability to manage them over time. It is critical that all organizations are PCI compliant to the entire data security standard all year long. However, as far as the assessment goes, when we come in, it's typically on a very defined period in time. So organizations that have to manage both PCI and HIPAA, in order to manage those kinds of projects, it's important that you have someone who understands both compliance standards and can map the requirements together effectively to help save on the level of effort that you have to invest.